Okay, well, thank you very much for inviting me. So I'm going to take a different angle really, and although I'm involved in the CLIMAR network, and these are the others in the management group who include anthropologists and specialists in international development and climate science and epidemiology, as well as microbiology myself. You know, that's, I guess, you know, an example of interdisciplinarity. But I'm going to really give you sort of a personal perspective, really, and my experience in working in this transdisciplinary field, I guess, and how are we going to bring that to the CLIMAR network. So so we're all familiar with this. One Health, you know. So One Health here in the quadripartite description, it talks about multiple sectors, disciplines, and communities. So I guess that is transdisciplinarity. Paul's already talked to us about the difference between interdisciplinarity and transdisciplinarity, so I don't really need to go there. But you know, I guess it is this stakeholder integration, isn't it? And that's the key thing. You know, how do you do that? And thinking about seeing things differently, I suppose my problem with One Health is that it immediately silos us into clinical or human focused and environmental focused and animal focused. Whereas really we want to be looking at the intersections of those. But I really like this. This is a 1997 diagram of AMR. It wasn't called One Health then, but we can see we have animals, we have humans, we have the environment, and this author Linton, these arrows indicate selection, antimicrobial selection. Black are high selective pressure and white is low selective pressure. I've inserted this here, so that's my modification. So low selection in the environment. But really, this actually does simplify what we are interested in. It's selection within these different compartments or evolution, and it's transmission between them, and ultimately transmission to humans, where we see, you know, in a pathogen host, where we then see infection. But this also tells us, you know, who we need to be talking to. We need to be talking to farmers, people working in abattoirs and food handling. So actually, really, you know, these systems maps, this is probably one of the simpler ones, but has a mechanistic underpinning. They sort of lead us down that sort of road of thinking about which disciplines we need, but also who we need to be talking to. And what CLIMAR is doing is really just thinking, well, how does climate change influence all of those different processes, or does it? And you know, thinking about seeing things differently again. This is a paper that I co-authored with Joachim Larsson, Ramana Lakshmanarian, and Ed Top, and this is sort of reframing One Health and having the environment encompassing humans and animals. And I think the reason we did that was because we think that we thought at the time that really this gives a better idea about the role of the environment. It is, of course, the reservoir from which much resistance comes, but also we're all within this matrix, this environmental matrix. So it's not something just added on, it's actually central and encompassing when we think about AMR. So then I'm going to really go a bit towards a personal journey, really. So and this is from my perspective rather than from CLIMAR. So my group really focuses on AMR evolution, ecology, and transmission. So right from the very beginning, it's trying to look at these different elements and how that contributes to the whole. And these are the priorities that I thought were important for my research in the last National Action Plan. And so really these were about understanding spread of AMR across the One Health continuum, and deepening understanding about AMR. So maybe some of that's about communication and actually about, you know, that side of it. It's talking to stakeholders and talking to policymakers, and also minimizing antimicrobial contamination. And so we of course did inform the National Action Plan. I guess this is the nature of transdisciplinarity, that, you know, your research begets impact, which then informs future research questions, and it's all cyclical. But I was thinking about this as well, you know, so what is the engine of transdisciplinarity? So arguably it's what we might call more formally knowledge exchange. And this is something that I've been interested in for quite a long time. And actually, it's been really embedded in our research programme for many years, probably actually from when I moved to Exeter in 2011, so for nearly 15 years. And we had two key relationships, really. One, working with the pharmaceutical industry and working with the Environment Agency more latterly, but maybe just, we were working with the Environment Agency to actually get samples to look at initially, and then that grew into something more concrete. But again, it's about those relationships with the individuals, but those individuals that are representing sectors that we need to understand more fully to co-create that research and those inform those solutions that we want. So I actually went into this even more formally, that I applied for knowledge exchange fellowships from NERC, and I was awarded 2 knowledge exchange fellowships, and that was working with the pharmaceutical industry, the water industry, with DEFRA, and really to talk about antimicrobial resistance, and to basically to communicate the results of research we were doing and that others were doing in this space, but also to learn from them what were the key questions that they wanted. So, and I guess, in the end, we can think about our research, how it informs these different components of policy development. And I would say now, I would think that our research has really informed all of these different stages, now actually moving even into the policy evaluation element, EU and UK levels. So I think that knowledge exchange and this transdisciplinary thinking, so it informs your own research. Your research then informs the impact, or it informs policy, which then generates or contributes to the research agenda. It's all very much interlinked. And so this is just illustrating that fact. Knowledge exchange really is the key component, I think, in communicating to non-academic stakeholders. So these are slides actually from a talk I gave to our local MP, sort of demonstrating this. So the work we did with AstraZeneca, it focused on researching these minimal selected concentrations of antibiotics. We did that research, we communicated that to the European Environment Agency and the Joint Research Centre in the EU. That then informed the hazardous watch list in the Water Framework Directive, and that in turn then, that informs policy, but also future research questions. And we did this for environmental exposure as well. So previously that was Amy Murray's work, this is Anne Leonard. So then we're looking at this environmental transmission, and we can see that that's then informed policy, but it also it informs future research questions. But critically, all of this research is informed by the perspective of those stakeholders. So the pharmaceutical industry in the former case, and with the Environment Agency and other organisations interested in environmental pollution in this instance. And then I guess this is again one of these slides for that talk to the MP. So talking about a JPI AMR network on environmental surveillance, and the key thing here was that in this network, which we then wrote a report on environmental surveillance, we had AMR specialists from Public Health England, UKHSA as now, APHA, from CFAS and from the Environment Agency. And that was actually one of the first times that those specialists from different branches of government had actually really spoken together about the problem because of this separation and siloed nature of AMR research. So this is just, I think, an example of how I've tried to address this problem. One of the most surprising things over the last 5 years, I guess, is this interest from big business and from investors. And we know now, I know now that this environment, social and governance issues that businesses are interested in includes antimicrobial resistance. And actually, this is a report that I contributed to by Aviva Investors that was focusing on antimicrobial resistance from this sort of triple planetary crisis perspective. So looking at the intersections between biodiversity, climate change, environmental pollution, and the impact on AMR. So And this is sort of what's underpinned some of the work that then we're going to go on and do in CLIMAR. So as well as working with the investment sector in this context, previously, so that actually then led on to work with the European Bank of Reconstruction and Development, and then we can feed in and inform policy coming out of these types of organisations. So you don't necessarily always have to inform policy. You can change practice in organisations and investor behaviour, which then is like a sort of more of a bottom-up, I guess, movement. And then the last slide in this is I was working with FAIR, which are an investor network that have member assets under management of $70 trillion in the intensive food production sector. So getting the message across to individuals in those sectors and undergoing or doing this type of knowledge exchange activities, which then can inform future research, I think it's been a key part of my journey into this transdisciplinary space. So for the CLIMAR network, we're taking this to the next step. So how do we see things differently again? So this is applying a planetary health framework to AMR. So we have these are the planetary boundaries in red where they're already being exceeded. So all of these, I think, can be related to AMR. So novel entities are antibiotics themselves. Climate change, we know there are links with AMR. Biosphere integrity is biodiversity, but of course microbial diversity is part of biodiversity. Land system change may be the built environment and the agricultural environment. We all know that wash and fresh water and aquatic resources are important, and also biogeochemical flows. So this is addition of biosolids to land, but also the geochemical cycles that are underpinned by microbial communities which can be impacted by antibiotics. But planetary health also has this sort of social or science elements, including Anthropocene in health, interconnection with nature, equity and justice, systems thinking, complexity, and movement building and systems change. So I think actually it really gives this mechanistic and conceptual framework. And what we really want to do is reach these people that are working in these different areas and that are concerned with those, and explain to them that AMR is also important for them to consider. So it's just a different way of communicating the complexity, I guess, of antimicrobial resistance. And interconnection with nature, for example, well, I think you can make analogies with COVID and SARS-CoV-2. So we know that we get emergence of zoonotic pathogens, but how many people really understand that resistance is emerging from natural microbial communities and then spreading in wave after wave of essentially pandemics to create the global pandemic of resistance that we have now. So that's an example of communicating in a slightly different way. And then ultimately we're interested in communication. How do you communicate with these different groups? So CLIMAR is working with this creative social impact consultancy, Skating Panda, to really think about how we do that in a better way. And this consultancy has been working with Dame Sally Davis and the Wellcome Trust in refining how we communicate AMR to those different stakeholder groups we want to engage with. And this statement here, science isn't finished until it's communicated, by Mark Walport, I think is really critical. So is it scientists' jobs to communicate their science? Arguably, you can't really do transdisciplinary research unless you are responsible for communicating your research and refining that communication to the audience you're talking to. And finally, this is my last slide. This is my last slide, and so this is this is from the quadripartite, the One Health Priority Research Agenda for AMR. Just a prompt to go and look at that website and see what's been done in this space. So yeah, thanks very much.